The CD is copyright by Charlie Curtis, 2013. All rights reserved. The CD is for the purpose of describing a procedure for pain control using meridian tapping and hypnosis. There are 4 tracks on this CD. The first track is a description of pain control. It tells you what to expect and how to use the other tracks on the CD. Track number 2 takes you through meridian tapping, a new procedure which has been discovered which greatly diminishes physical pain, often dramatically, in just a few minutes. Track number 3 is a relaxation process. And track number 4 has some post-hypnotic suggestions for deep pain control. Hypnosis has a long history of being used for pain control. In fact, it has been well known for hundreds of years that the body is capable of the complete release of pain through the hypnotic process. In fact, if you've ever used or heard about some of the natural childbirthing processes, which use breathing and imagery to reduce the physical discomfort of giving birth, this is an example of hypnosis used for the relief of pain. In fact, there's even a process called hypnobirthing, which a hypnotist can learn and then can teach someone who is about to give birth. One of the earliest uses of hypnosis, hundreds of years ago when it was first discovered, was for the purpose of relieving pain. Back then there was no chemical anesthesia, and so the methods used to relieve pain for surgical operations were very primitive. Things like alcohol and things like just putting up with the pain. It was not a pleasant process. And so, in contrast, hypnosis proved very elegant. And there were several physicians at that time who used hypnosis and did hundreds of operations, including dramatic things like removing injured or diseased arms or legs. There have been open chest, open abdomen, surgeries, prostatectomies, hemorrhoidectomy, cesarean section, and other things that you would not think could be done without anesthesia, and yet with hypnosis as the only anesthesia, this has been easily accomplished. In fact, one of the first laboratories for hypnosis, which was at Stanford University, did research, scientific research on hypnosis for the relief of pain, and found that it was dramatically effective when it was done skillfully. And so that's good to know, because it means that you can expect to get a result when you go through this process, that this has been proven scientifically, that there are research studies that have been done and replicated where people were able to relieve pain through the power of the mind. This can be used to relieve chronic pain from an accident, from an illness, from an injury, from something like cancer, from something like pain, from a nerve being pinched. So simply assume that if you have pain, that we can make it less. The goal would be to make it disappear. But even any kind of diminution of pain is valuable And so that becomes the goal. If you were to look at a textbook of the kind written for physicians on how hypnosis can be used in various medical procedures, you would be astounded to find how helpful hypnosis is, and especially how it can be removed noxious sensations from the body. Anytime there's an unpleasant sensation in the body, hypnosis can be used to remove it. And so the way to approach this process is with an open mind, and to expect the best and accept any change that you get as a positive sign and as a good result. And before I go on, I'd like to explain the other 3 tracks. There has recently been discovered a process called by different names: meridian tapping, EFT, tapping on acupuncture points. There are certain acupuncture points that if you tap on them, they will reduce physical pain. It's not altogether known at this time why this is true. There are various theories that it affects an energy system of the body that consists of a subtle energy that's difficult to measure using today's equipment. But for whatever reason, acupuncturists have known for several thousand years that putting needles at certain points in the body would relieve physical pain. And now we have found that tapping on these points with the fingertips will also relieve physical pain as well. And so the physical points that I'm going to have you tap on are the ones that have been proven to work successfully in the relief of pain. And if you are interested in finding out more about this, get on the website www.eftuniverse.com. That's www.eftuniverse.com. Another website is thetappingsolution.com. thetappingsolution.com. And if you go into a web browser and just type meridian tapping or EFT, you'll find other sites and fascinating articles. This is now something that has had so many studies done that it is now considered an evidence-based technique for removing not only physical pain but psychological pain. And it is now being used in the psychological professions to reduce emotional pain. So you may find, as you tap through these points to remove physical pain, that your emotional pain diminishes and disappears as well. To give you an idea of the type of result that can be expected, I have personally seen it used to remove the pain of auto accidents, of pain in the back, twisted muscles, tight lower back pain, muscles in the neck, headaches, sciatic nerve pain, buzzing in the foot, all kinds of things. And then, of course, pain from specific illnesses and specific injuries. I have seen people in great pain that 5 minutes later, the pain was totally gone. And if you get on these websites and look at the stories, you'll find out that many other people have had the same experience. And so while we still don't understand all the reasons why this process works, we do know that it works, and it's a good thing. And so track number 2 will take you through the tapping process. Track number 3 and number 4 will take you through hypnosis, and then post-hypnotic suggestion. Now, all hypnosis is is a relaxed state. You've been in hypnosis many times, falling asleep, waking up, reading a novel, getting absorbed in a TV show, spacing out at a traffic light, feeling relaxed, watching a fireplace. Any of these relaxed states of focused attention can be called hypnosis. So anytime you're in a focused state and you receive a suggestion, you are more susceptible to it. And so if you get in a relaxed state, which is what track 3 does, and then you receive focused suggestions for pain control, for pain management, which is what track 4 is, that's hypnosis for pain control. And the reason the two tracks are separated is track 3 being an eyes closed meditative process. You don't want to listen to it while driving. And you may want to listen to the pain control suggestions either while you're driving or when you're so relaxed that you don't need relaxation. And so in that case, you can go right to track 4. And so you listen to track 3. If and only if you want to put yourself in a relaxed state, then listen to track 4. Post-hypnotic suggestions for experiencing pain control for a period of time. Track number 2, the meridian tapping, you can do anytime, and you can do it totally separate and distinctly from the hypnosis and the post-hypnotic suggestion. You can do track 2 by itself. Now, before we go on to track 2, I want to introduce you to the points that you're going to be tapping on, so that in track 2 I can simply concentrate in tapping on the points rather than teaching you the points. So in order to teach yourself the points, you can do this with either hand on either side of the body. Take 2 fingers, your first 2 fingers, your index finger and your middle finger, and you want to tap between the eyebrow and the nose. Tap hard enough to feel it, but not hard enough to hurt. And tap about 10 times. And as you tap through these points, you'll feel your body relaxing. And in fact, you can use this for stress relief anytime. You don't even have to be experiencing physical pain to benefit from this process. All right, now move your fingers to the side of your head, next to the point where your eyes are. So it's on the side of your head, in front of your ears. This is called the side of eye point because it's next to your eyes. And again, tap hard enough to feel it, not hard enough to hurt, about 10 times. And now tap under the eye, so you're tapping on the cheekbone under the eye. And so it's a little bit of a softer place. And again, tap about 10 times. And you'll find as you tap, it's a pleasant sensation. It makes the body feel more relaxed. And if you're doing this for pain control, you'll find the pain diminishing as you tap through the points. Now tap under the nose, where a man's mustache would be. Now tap under the mouth in the cleft of the chin. And you may already notice your body beginning to relax and your mind becoming quiet. And now tap the collarbone point. If you follow your collarbone down to the center of your chest, either collarbone you can use, then move to the side a little bit so you're no longer on the collarbone or the ribs, but you're in a soft place. And just tap in that soft place. It's called the collarbone point. And if you're not sure where it is, if you were to take your fist and tap in the center of your chest, you would be tapping on both collarbone points at the same time, one for each side. So you tap on the collarbone point, and then the next point is under the arm, It's not in the armpit, it's down a couple of inches. And again, just tap about 10 times. And then go right to the top of the head. Tap about 10 times. Now, if you look at different websites and different books on meridian tapping, some of them use other points. For example, there are points on the hands and the fingers and the back of the hand that you can use. But these points that we just tapped will get the job done. They'll get your pain to reduce. And so now I'm going to go ahead and go to track 2, and that will take you through the specific meridian tapping to relieve physical pain.